without further ado, let's see if we can get Parul in on here. Many of you guys will know Parul, I'm sure. She's done some, hi Parul, she's done lots of help already on social media for core medical trainees and those applying for internal medical training. Some of you guys might have been on her Facebook Live a couple of months ago. So welcome, Parul.
Hi.
Thank you so much, Parul, for coming in and doing this. Internal medical training or core medical training is an area that many attendees have mentioned that they're looking at applying for. We're just going to run a quick poll before you start your talk, guys. So we're going to launch this poll now. Please answer yes or no. Have you at any point, or are you currently considering a career in medicine? So internal medical training, core medical training. Remember, like we said, if you're thinking cardiology, gastroenterology, neurology, respiratory, any of these kind of backgrounds, then IMT or core medical training is one of the things that you'll be thinking about right now. So come on, let's get some votes coming in. We've had about a quarter of you vote so far. Let's try and get these numbers as high as we can. 3 more. Okay, perfect. Okay, let's have a look. So 70-30, so 70% have considered a career in medicine. So this talk is very, very important for you guys. Parul is a core medical trainee currently in London. I first came across Parul for PLAB 2, and I've kind of seen how she's developed her career since then. And it seems to be going from strength to strength. So this is going to be a really important talk, I think, for you guys. Parul, we're going to hand over to you, and let's let you take it away.
Thank you so much for the introduction, Dr. Aman. I'm going to do the till I get my slides up. So, hi everyone, my name is Parul, and as you've heard, I am an internal medicine trainee at Northwick Park Hospital at the moment. And I want to talk to you about internal medicine, how I have gone about to apply for it, and what you should be doing, and should you apply for IMT or not. So I thought I should just take you through my journey with pictures, and you'd realize how much I love my pictures. So that's me in India. I graduated from Government Medical College Patiala, Punjab in India, and I would say that I didn't know anything about PLAB or the UK medical system, because I was more focused towards doing USMLE at that time. Basically, I didn't know this existed. And then after I finished my internship, someone told me about PLAB. And without wasting any further time, I think I did my IELTS exam in like a month's time, and then went on to do March PLAB 1. And things just worked out for me at the moment. Basically, I think then I just, toured around and came to the UK in August and did my PLAB 2 exam. And before that, obviously, I met Dr. Aman, and he had this amazing ethics and communication skills class that I think actually led me to this point where I got GMC registered. This picture was taken by the woman who registered me, because I was just in tears. I couldn't believe I made it to that point. I think I've spoken to so many of you guys who think that that point is never going to come in your life. Believe me, it will. And then I just went around the UK, and that's me. I decided to stay in the UK before my PLAB 2 results came out, and I decided to do clinical attachments. Now we're talking about 2018. Things were amazing back then as compared to this pandemic time. I had a dear friend, Deepsha, guide me to how to get clinical attachments. And basically, I emailed about, say, 80 to 100 consultants on their email addresses to take me in for a clinical attachment. I sent my CV across. I wrote why it was important for me to do it. And I think about 3 of them replied. So that was not bad. So I did a clinical attachment at John Radcliffe Hospital in Oxford and at Northwick Park Hospital in London. And I made use of this book, which is so important. I can't even stress how important this is. It's got literally everything that you need to know before you start a job in the UK. Of course, the importance of induction. I can't overemphasize that, as we've spoken about before in this talk. So without wasting any more time, let's just talk about what is IMT, why you should do it, and how to apply, most importantly. And I will talk to you about my journey in between. So IMT is the primary entry point for a career in medical training. As Dr. Aman said, if you want to do cardiology, neurology, gastro, literally any medical career, including dermatology, I know that in India, you can apply for dermatology or stuff like pathology, oncology without doing internal medicine, but that's not how things work in the UK. You have to do 2 or 3 years of internal medicine. It's amazing. I love medicine. I can't say that enough. The duration, sadly or not sadly, is 3 years now. It's because of the new curriculum introduced before my session, and there will be an IMT 3-year, which will start from next year, which basically is just to prepare you for the next, specialty training route, to help you act up as a registrar before you're just thrown in the deep end. So first 2 years are as a senior house officer. So I did my internship in India and I didn't do any jobs. Like I did like a month or two here and there, but then I didn't do any proper jobs, and I came directly to the UK and I started working as a senior house officer, which is an F2 level. Anyone from F2 to IMT2 or CT1 to CT2 are called as senior house officers. So that's where you start. And then there's a 3rd year introduced where you can act up as a reg. There are 2 groups of specialties, which determines how many years you do in medicine. So application is made on Oriel. I think if you're interested enough, you must have heard about Oriel. It was a difficult website, I'm not going to say that, but now they have introduced new website and it's much better. So I'd encourage that you start looking at it, make an account and start filling the details. Applications for IMT open around November, so round 1, which was till 1st of December this year. Rounds are round 1 and round 2. So basically, I think from what we know from before is that IMGs could only apply in round 2. That's not the case. Yay, I love it, because I think I'm very lucky, because when I applied for IMT, I applied in round 1, and I love the system in the way that they have actually brought everyone at par. So there was like a preference for UK grads, then EU grads, but then the 3rd ones were IMGs. But now everybody is at par. So you can go in without the fear of your nationality or your, the place where you studied. You can't be judged for that. You only be judged for your clinical skills and your love for medicine. You may reapply in round 2 if you're not successful, if your circumstances have changed, if you're waiting an offer. But and the post starts 1st Wednesday of August every year. This is like a standard in the UK. So this is what I was saying before, Group 1 and Group 2 specialties. This is relevant because I think you need to know this from the start, that this is the amount of years you're going to invest into your training. Group 1 specialties like cardio, neuro, gastro, nephrology, rheumatology. If you can see on the, I don't know if you can see my mouse pointer moving, but if you see the purple box, it says 3 years of internal medicine stage 1 training, and then you go on to your specialty training, which is 4 years. And then you move to Group 2 specialties like dermatology, oncology, hematology, in which the purple box says you only do 2 years. Everything else remains the same. Eligibility is an important thing, and I think that's where all of us get stuck as well. Foundation competencies goes without saying. When we start a job in the UK, when we get GMC registered, fully registered, that means that we are capable of working at an F2 level or a foundation level 2 level. And then you have to get signed off that you've done things that a UK graduate will do as an F1 and an F2, which is right after their medical school 2 years. For most IMGs, we will follow an alternative pathway like I did, which is a CREST form, a certificate of readiness to enter specialty training form, which changes every year, and you need to look at the updated version. It's needed at the time of the application, so you need to have the form signed in November, before November when you apply. It can be signed by any consultant, ideally in the UK if you're working here, or even from your home country. You have to have worked with this person for 3 months in the last 3.5 years. And if they're not on the GMC register, you have to prove that they have the equivalent qualification or registration as per consultant in the UK would. If you're doing a standalone post, you don't need that. experience 24 months. Many people get confused about this. I got confused about this. You need 24 months experience after your MBBS. And many countries, like in India, we have internship year, which is included in MBBS. So that year counts, and any international experience counts in this. Language skills, we all know IELTS, OET, was your degree taught in English. And actually, if you are GMC registered by the time you apply for IMT, you already have had these things looked at before you got registered. So you don't need to prove your language skills again. ALS, very important, and obviously very difficult in these times to get hold of. And I think you can't get your CREST form signed without ALS or without making a booking for ALS. ALS, it stands for Advanced Life Support, and it's offered by Research Council UK and some European countries. Please make sure that this is not ACLS. ACLS is not valid. Advanced Cardiac Life Support, which is offered by American, I don't know, Americans. No offense. So basically, this is the interview. I think this is the most important part, because when I applied, I didn't have anything like, you know, the pre-application scoring. I thought I'm never going to make it, but I think all the difference applies in the interview, really. So interview invitation this time you're going to get by 23rd of December, and because of COVID, we're doing the interviews online this year, and it will be Monday to Friday from 18th of January to 12th February. Interview includes these things. So they want to look at you as a holistic doctor, not just someone who can treat heart failure or someone who can, you know, treat asthma or status epilepticus. They don't want that. They want everybody has same medical knowledge. I mean, I could go read a book today and know the same as you know, or the person next to you knows. But what makes you you and makes you suitable to apply for this is tested in these stations. So you have clinical scenario. So basically, many interviews, I think they ask questions like, say they've got a scenario, you go in and you've got, say, an 85-year-old lady who's come in with shortness of breath. She's got heart disease and she's got edema all over her body. How are you going to assess this patient? How are you going to manage this patient? What else would you do? So they want to know, are you going to do the A to E assessment or not? I am going to say this today and forever. A to E is your holy grail. Please, 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 please do that. And it not only applies for IMT interviews, but for every other interview in your life. When you manage patient from A to E, you're demonstrating that you're a safe doctor. That's what everyone needs. And then also it involves you escalating if you don't know what to do. I mean, you're not supposed to give inotropes by yourself. You can always have senior support for that. And what they're actually looking for is how well you communicate during this. Are you just doing it by yourself? Are you communicating well with the other people, staff members? Are you making use of every other healthcare professional you have? And also in the interview, you need to verbalize things. I wouldn't just be like, in my mind, I've put the patient on oxygen, but I haven't told the examiner. They're not going to know that. And especially as IMGs, we tend to do this. We just play the scenarios in our head and we don't say it out loud. That's not how it is done. But it needs a lot of practice, believe me. I didn't do that right as well in the first place. Ethical scenario will test you on your moral, ethical, legal issues about a particular situation. For example, very common situations be like, a patient's got cancer, you know that. Family doesn't know that, patient doesn't know that. Family comes to you, tell us my mom's got cancer. Don't tell the mom that she's got cancer. You can't do that without the patient's consent. So this is the kind of questions you get. Obviously, I don't have time to go over everything. And then I think the best place to look for guidance is GMC's Good Medical Practice Guidelines. I've read it through from like beginning to the end before my interviews. Suitability and commitment, my favorite station and where you can shine always. Here is where you're going to tell them about your career to date, your opportunity, how you're going to use IMT as the opportunity to develop your further career. Why IMT? That's the major question. And also they're going to ask you interests outside medicine. Nobody wants to appoint a dull doctor because, you know, as I said, medicine's the same. You have to be a charming person. You have to be interactive. You have to have a good understanding of ethics and everything around that. And they'll love you. So basically, this is not how you should look like if you love medicine. this is what you should look like. And application and training, your career achievements to date, and your engagement with training and learning. Stuff like if you say you're doing a trust grade job here, what have you done in say you did a trust grade job? Like I did a trust grade job when I started here, first few months in cardiology, and then I went on to do a rotational post. I didn't have anything like QI projects or teaching, but I did all of that during my trust grade years. And I think that's what they want to know in the interview. Portfolio, basically I've got so many questions about this on my email address from so many of you. Yeah, so okay. So basically your portfolio consists of these things. They're going to ask you about your achievements, if you've done a quality improvement project, leadership roles, presentations and posters, MRCP, and your commitment to specialty. I have just shamelessly copied these things from the IMT website. There's nothing new. I have not made it. So if you've gotten additional undergraduate degrees, like I think in India, and most of us, we don't do BScs, but it's kind of integrated in the course here in the UK. People do BScs. So you can score for that. If you can't, please just move on. It's okay if you don't have it. I didn't have it. Postgraduate degrees, MRCP doesn't count, guys. It's only PhDs, MDs. Some of you will have that. Additional achievements, please, if you've got any honors, distinctions, scholarships, please, this is the time to boast about it. Don't be modest in these interviews. Presentations and posters, national, regional, local level, if you've presented anything, if you made posters, you've been invited or selected to do so, you need evidence for all these, especially in times of COVID. If say your conference been delayed or something, but you got an email saying that, oh, so you're invited to present, please accept this invitation. So please use that as the same as you got invited for an international medical meeting, so you can score yourself for that in times of COVID. Publications, I didn't have any. I still don't have any. But if you have, amazing, you can score yourself for that. But don't worry, I did it without publications. Teaching is one of the two most important things. If you've designed a teaching program, which I encourage you to do so, you can score yourself maximum marks. But even if you go around teaching, bedside teaching, you can score yourself for that. And this is invalid if you don't have formal feedback. So please make Google Forms or paper forms or something and get feedback about your teaching and things you can improve about it. Training and teaching, again, is some people have master's degree. If you don't have, don't worry. You can do some online training modules, or you can do the teacher's course. I did one. It costs a fortune, but it was amazing. There are many companies that offer it. Quality improvement is the other important thing. Quality improvement is basically, I love this idea that you go about your practice and you audit yourself, what you're doing, and you make improvements in it. And who is the best person to do this apart from you? Who's doing it? So basically, QI means that you look at a problem, you look at something, you see that's a problem, and then you be like, I have to improve it. And then you do something to improve it, and then you study again, and then you're like, hurrah, I've improved it. So that's basically the PDSA cycle, which is plan, do, study, and act. So say there are many national audits going on, say VTE audit, VT prophylaxis audit. See, you've seen that not many patients are on VT prophylaxis in your ward. So you go about and you read everybody's drug charts, and you find out that only 50% of them are on VT prophylaxis. Then you plan, okay, this is bad. Someone might have a PE or a DVT, and then someone actually might have had. So this is something that's close to your heart. You want to do it because you want to do it, not just for the sake of scoring that 10 on the portfolio. So then you sit down and you try and make improvements. You go about telling the pharmacists, the doctors, the nurses, and everybody. You make posters about it. And then you study it again. And then you see 100% of them are on VT prophylaxis. Amazing. That's your QI project. You have improved the quality of your care. If you present these results, you score maximum marks. And if you're involved in any of these steps, that gives you marks. Leadership and management, not all of us have held leadership roles, but if you have, for say student unions, your mess, doctor's mess, or even non-medical roles, they all count here. This is what I love about the UK. They look at you holistically. Your portfolio, please, 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 should not look like that when you go for live interviews, which I really, really wish happens soon. This is how your portfolio should look like, with beautiful tabs and everything. And please invest in a good suit. That's again me just before my IMT interview. Please invest in a good suit. And even if it's an online interview, please look your best. Contingency plan is something that that applies and is very relevant at this point. Is that what happens if COVID reigns all over it, which it already has anyway. You would be asked to upload the evidence for all these things that I've just told you. Maybe you scored yourself 20 for this, like I did. And then you'd be asked, like, why do you think you deserve a 20? You just upload your evidence in 1 week's time. You scan all the documents, you put, like, you know, you were invited to a presentation to present somewhere, you have completed a QI project, you have a certificate from the audit department, or you have like an email from a consultant or a letter from a consultant. Then someone will look at these documents and be like, sorry, can't score that for yourself. Score can be increased or decreased, which wasn't in my time. I actually happened to underscore myself, and they told me in the interview that you should have scored yourself 6 where you scored yourself 1. And I was like, oh my God, I'm going to lose it. But that didn't happen. Commitment to specialty will be looked at most importantly, along with essential skills. As I said before, communication is the most important thing. You have to be able to communicate around with your colleagues and with the patients, most importantly, which is a skill that most of us might lack. Not to mention, teaching and QIP has taken precedence over everything else. So the round 2 of last recruitment that happened, everybody was asked to put their teaching and QI evidence more than publications. Offers, then, if you're lucky, which you will be after my talk, you will get an offer. You have to put your preferences, and you'd be like, I want to work in this region, that region. Please research about it before, and then you'd be offer upgrades. Like I put Northwest London on the top, and I got it. Just with one upgrade, I wanted renal at a hospital, and I got into it. Please, you won't get downgrades like I thought I will. So please be very vigilant about your preferences. You can hold if you're applying to multiple specialties. Basically, many people apply to 3 specialties at a time. And if someone gets a better opportunity on, say, radiology or something, they're going to take that. And then you get placed here. And then, yeah, basically that's that. These are all the timeline things that you can read on the website. And round 2 might not happen this time because of COVID, again, to take the obvious. But I'm hopeful for the next time. I have looked like that at many points in my life when I came here, because I have to stress this, that no one who's not been through your journey will ever understand what you've been through. It was difficult. It was very difficult leaving my family, my parents, my culture, my food, my dogs, to come here and live alone all by myself. It's very difficult. The weather's weird. I go to work when it's dark, I come back when it's dark. But and many birthdays will be like that. That's my family on one side, and that's me. We organize a Zoom meeting. And you know, you'll have times. That's when I got my IMT offer. My parents sent me cupcakes, and there will be many video calls with Cooper, my dog. But then I would tell you it's worth it, because the UK has proven that to me. I've been given chances that everybody else has been given. I have developed my career over these years as trust grades and then apply for IMT. I haven't seen any preferential treatment. I mean, things happen, isolated incidents happen, but it depends on you. So I want to tell you today, the take-home message for you today would be, please, 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 this is your system. You have to stop thinking that this is not your country or this is not your system. The only way I think I succeeded in whatever I've done till now is that I owned it, and I love this system, and I'm committed to improving it and, you know, doing the best for it. It is my system, and you do the best if you consider the same. So with that, I want to thank Dr. Zaman and Pooja Arora, Dr. Nasir Khan, who's been very helpful, Dr. Raheel, who's helped me with IMT application last year with his talk. I can't thank you guys enough. And those are my contact details. I try to respond. I've helped many people with the NHS, so the job portfolios and interviews and applications. And I will respond, even if I take time. I will try and help every one of you out. But please believe I am in a very busy job and I might not get time to reply, and there's a time difference. And lastly, if you think you look as good as me in those pink scrubs, then probably it's time to reconsider your medical training. Please become a surgeon. Thank you so much.
That's brilliant. That's brilliant. Thank you, Parul. Really, really heartfelt talk. Really, you could tell that's coming from the heart. And it's a journey that you've been through, that a lot of IMT doctors have been through or are going to go through. And I think hearing it out in such an honest way was really useful. And loads of facts in there. And obviously there's things that people need to go away and reread and look through in more detail, and watch this back again, because there's lots of stuff that you covered there. And I think it'll help a lot of people out. Pooja, your thoughts?
Absolutely amazing as always, Parul. Lots of useful information broken down into a simple manner, and we can see that on the chat and the questions. Lots of people finding it useful. Unfortunately, guys, we're a bit behind, but I'm sure Dr. Parul will be kind enough to answer some of your questions. So if it's okay, Parul, if you're okay to stick behind for maybe 5-10 minutes, we can allocate you some of the questions, mostly around quips and when they can take their MRCP and things around, their portfolios. I'll allocate those questions to you. And if you don't mind, just put your contact details in the chat function for everyone to see, if you're happy to do so. But thank you, Parul. Really useful talk. So thank you.